Well, very good news this afternoon with the Assembly unanimously supporting my amendments, Plaid Cymru's amendments to the Public Health Bill, which will make it a requirement now for the government to prepare a strategy to deal with obesity in Wales. It's one of the big, if not the biggest public health challenge that we face in Wales. The job now, of course, is to make sure that the government prepares a really strong, ambitious and deliverable strategy to deal with this. So that's great. Not so good. Earlier this afternoon, in questions to the First Minister, I put a series of pieces of evidence as to why our mental health provision in Wales is really struggling, in particular in my constituency in Ynys Môn. Now, the First Minister doubted the evidence that I put to him, and he showed no sympathy, frankly. Have a look what you think.
Thank you, Llywydd. Does the First Minister truly understand how much of a crisis there is facing us in terms of mental health care in Wales? In Ynys Môn, I understand that there is now not a single psychiatric consultant for mental health patients between 18 and 65 years old. Health professionals are working under huge pressures that they can't cope with. They fear that they are having to make decisions which will be a risk to patients. The shortage of beds means that people are taken as far as London to be treated or receive care. There are dozens of children and young people who are sent to England for treatment, and over 200 mental health patients in North Wales have been transferred out of Wales in the last 22 months. Now, the whole system is on its knees. When will the government take action in order to safeguard some of my most vulnerable constituents?
I do not accept the figures that the member has listed in the chamber. First of all, the funding for mental health has gone up to 629 million for the ensuing financial year, and that is safeguarded. Health boards have attained and actually exceeded their targets as regards mental health services in some areas over the past 12 months. And of course, although more people are transferred into CARMS, the health boards are confident that the situation will demonstrate that every CARMS service in every part of Wales attain the 28-day target before they get a new appointment. And so very many improvements have taken place over the past months.